53-year-old man evaluated for 3-week history of fatigue, headache, visual change, dyspnea with exertion, and dizziness. He has smoked a pack of cigarettes a day since he was 20. He has hypertension and takes enalapril. His vital signs include blood pressure normal, heart rate normal, temperature normal. On physical examination, there is splenomegaly. A complete blood count reveals thrombocytosis with 7 lakh cells per millimeter cube. Lab finding shows decreased iron saturation, serum ferritin, and increased total iron binding capacity. A blood smear reveals increased number of abnormal platelet, and bone marrow aspirate confirms dysplastic megakaryocyte. A mutation on chromosome 9 confirms physician's suspicion of clonal myeloproliferative disease. Patient is started on hydroxyurea, which of the following is most likely diagnosis. Myelofibrosis with myeloid metaplasia, essential thrombocythemia, CML, polycythemia vera, or aplastic anemia. This patient is having thrombocytosis and decreased iron. Nothing is written about WBC, and there are abnormal platelets. Bone marrow shows megakaryocyte. So reading this question, I get a feeling that this patient is having essential thrombocythemia. And they have given another guessing point, which says that this patient has a mutation on chromosome 9. So essential thrombocythemia has JAK2 mutation, and myelogenous leukemia has 922 mutation. JAK2 gene is located on chromosome 9 only. So this is a fact that you have to remember. So chromosome 9 has this JAK2 gene, which is mutated in essential thrombocythemia. And that is why the answer to this question is essential thrombocythemia, because he is having thrombocytosis and all features consistent with essential thrombocythemia. This is not CML, because in CML there is increased proliferation of WBC, especially neutrophils, which is not written in this question. Plus, the first line of treatment for CML is not hydroxyurea. It is tyrosine kinase inhibitor, imatinib. Okay.
Thanks for watching. Please give a thumbs up and subscribe for more.